Hello, everyone. Thanks for joining us here on CBS News. I'm Christina Ruffini.
And I'm Elaine Quijano. We are beginning with breaking news.
President Joe Biden has tested positive for COVID-19.
The White House says Mr. Biden, who is fully vaccinated and twice boosted, tested positive this morning. We're told he will isolate at the White House and continue to work from home until he tests negative. The White House doctor says the president's symptoms are mild. He went to bed feeling fine, but had trouble sleeping and tested positive this morning. We are starting with CBS News. Chief White House correspondent Nancy Court is joining us now from the White House. So, Nancy, what are you hearing about how the president is doing and how he's being treated?
Hello, Elaine. Hello, Christina. The latest we're hearing from White House officials is that the president has mild symptoms, as you mentioned. He woke up this morning tired, runny nose, dry cough. They said he went to bed feeling fine, but didn't sleep that well, and then woke up with these mild symptoms, was tested, and he was positive. Very soon thereafter, he was put on that 5-day course of Paxlovid, the antiviral, and at this point, he is working, isolating in the White House residence. His wife, the First Lady, we're told, hasn't seen him since yesterday morning because she has been traveling separately. She's actually in Michigan today, where she told reporters that she has spoken to the president, that he is feeling fine, that she's feeling fine, and that she's going to continue with her schedule. She's going to be in Georgia today. She's supposed to overnight in their hometown of Wilmington, Delaware, and then presumably will continue to stay there for some time so that the two aren't in close quarters. Up in the air is the president's schedule next week. He was supposed to go to Orlando on Monday for a crime event to meet with law enforcement officials there. Clearly, that's unlikely to happen, and depending on when he tests positive and when he starts to test negative, will determine whether he's able to get back to a more normal schedule with meetings sometime soon.
And Nancy, do we know who the president has been in close contact with, either at the White House or Capitol Hill, or, he's been traveling recently? Who are those people? Are they quarantining, and what are the precautions of the White House?
He has been around a lot of people in the past 48 hours or so. Whether or not the White House doctors are going to end up considering all of them close contacts remains to be seen. There have been a number of times in the past when a White House official has tested positive and has announced it, but then the White House will tell us that the president himself wasn't considered a close contact, even though we know that that White House official met with the president. But if they weren't sitting very close together, if they were masked, if they were together less than 15 minutes, then the White House will determine that actually they weren't close contacts. So we're still waiting for that official determination. But we do know that yesterday, for instance, he was on Marine One and on Air Force One with at least 8 White House officials. We saw them with him, particularly when you're on Marine One. You're in pretty close quarters, and these White House officials and the president don't tend to wear masks nearly as much as they used to. When he got to Massachusetts and Rhode Island, he got off of Air Force One. He shook hands with the governor of Rhode Island. He shook hands with 3 U.S. senators, a couple of House members. And the day before that, we saw him with the First Lady of Ukraine. So he was only with her for a few minutes. They were outside. Probably unlikely that she'll be designated a close contact of the president, but we'll still have to wait and see and hopefully get more answers in this briefing that we are expecting from Dr. Ashish Jha, the White House COVID coordinator, in a couple of hours.
And Nancy, in addition to that domestic travel, there was also recently travel to the Middle East. Can you talk to us a little bit about what we saw there with respect to the president and his meetings, how close he was to other officials, and whether or not masking was something that we saw him do while on that trip?
He was not always masked, and he was surrounded by world leaders, particularly Arab leaders in Saudi Arabia over the weekend. The White House said before he went that he was mostly going to try to fist bump leaders in Israel and Saudi Arabia to cut down on the risk of COVID transmission. That was also most likely an attempt to cut down on the risk of embarrassment from shaking the hand of Mohammed bin Salman, the Crown Prince of Saudi Arabia. who the president in the past has said should be considered a pariah. Nevertheless, he didn't shake quite as many hands as usual, but as you can see there, he was surrounded by officials. Now, that was, let's see, that was on Saturday, so we're talking about 5 days ago now. Not out of the realm of possibility that he could have become infected there in Saudi Arabia, but more likely, I think doctors would say, it has probably happened sometime in the last several days when he has been here stateside. But obviously, pinpointing where exactly he got it, as it is for all of us, is probably pretty complicated for him as well.
And Nancy, I heard you mention earlier that it's kind of a miracle he hasn't gotten it previously. And frankly, I thought the same thing because, you know, you've covered Senator Biden and Vice President Biden and President Biden. And this is a man who really likes to get in the crowd. I mean, I have this memory of one of the dinners from back in the day when he was the guest speaker and he jumped off the stage and spent about an hour shaking hands and taking photos with people. That's something he's not really been able to do. And now they're finally easing him back into that. And this happens. Right. Do you expect to see them curtailing physical access to the president, at least for the next couple months?
Not only does he like to be around a lot of people, Christina, but probably to the chagrin of a lot of his doctors, he's a close talker. You know, he really likes to get in there with people. Sometimes you'll see those pictures of him forehead to forehead with individuals when he's trying to comfort them, someone who has experienced a loss, who has come to him to talk about that loss. You know, you'll see him with his arms around individuals that he meets either out on the road or here at the White House. He's somebody who likes to be around people and to get close to them. And as we know, the closer you are to people, the more likely it is that if they have COVID, they can transmit it. Now, when people come here to the White House to visit him, they do have to get tested, especially if they're going to be in close quarters with the president and be inside. But as we also know, you can test negative 1 hour and then test positive a couple hours later, and you'll have had that underlying infection that wasn't detected at the time. So, yes, there are any number of places the president could have gotten it. He actually had a light public schedule on Monday and Tuesday when he got back from Saudi Arabia, but that doesn't mean that he wasn't meeting with any number of administration officials, White House officials, meetings that didn't necessarily end up on the public schedule, that weren't open to reporters like myself, but that nevertheless were taking place as White House officials debriefed him on everything that had taken place in Israel and in Saudi Arabia, and also domestic issues that he may have needed to catch up on after 5 days abroad. That's
right. A light day for the president is still a pretty busy day for the rest of us. Nancy, if you could hold on for just a second, let's bring in CBS News chief Washington correspondent Major Garrett. Major, now there is precedent for an American president getting COVID. Of course, I'm talking about former President Trump, who tested positive on October 5th, 2020. That was before vaccines, and it was much more serious. And as we mentioned earlier, I was outside Walter Reed, and people were very stressed out. People were very concerned. When you look back, what stands out to you from that time versus what we're seeing this go around?
Very different times. The virus is a very different animal medically than it was then, and a very different approach between administrations. The Trump administration had kind of an ideological hesitancy to believe that COVID was as threatening and as dangerous as many public health officials suggested at the time. And their attitudes and protocols reflected that casualness. President Trump contracted the virus nevertheless, because the virus, as we have learned, cares nothing about ideology or political party, and the president was very sick, much sicker than it was publicly released at the time. He tried a vigorous comeback from COVID, but he received a tremendous number of medical interventions at Walter Reed, had to go there, was hospitalized, had oxygen deficit that was worrisome to White House physicians. All of that transpired then. Now we're in a situation where President Biden, twice vaccinated, twice boosted, manageable, mild symptoms. Paxlovid is an intervention that works for millions of Americans already to deal with this subvariant, but nevertheless contracted the virus. And from my perspective, and I think from a lot of people who cover the White House, the Biden administration has three challenges in front of it immediately. One is a medical challenge. Make sure the president is healthy and gets back to full health as soon as possible. It has a management challenge. Even if you're not really sick with COVID, a positive test is disruptive. Why? Because you have to isolate. And isolating a president from senior advisors is suboptimal, to put it mildly. It's very difficult to run a White House under the best of circumstances, but not meeting with people, not seeing the president's own attitude about issues and hard questions personally is difficult for senior White House advisors. That connectivity really matters. That's not going to be possible for at least 5 days, possibly longer. The last challenge of the three is political. Back on July 4th of last year, the president declared our national independence from COVID. That hasn't played out. He has inflation, crime, immigration, general unhappiness with the direction of the country. The only area in which his administration, in survey after survey, had a net positive assessment from the American public was management and dealing with COVID. That's going to take a hit now, and the White House is going to have to explain how, after so much time, so much intervention, so much federal dollars, COVID is still with us, and how to assess the risks and how to practically mitigate those risks and try to stay at work. Because if there's any employee in the United States who needs to stay at work, it's the President of the United States.
So, Major, on that exact point, how challenging politically has this issue been, and will this issue now be for a president who, as you note, has tried to strike this balance between projecting this notion of having a semblance of control over what is happening with this virus, and at the same time wanting to have the country open back up for many reasons, including economic reasons, and get to some level of a normality again. Just how difficult a challenge has that been?
It's been a big challenge, and one of the things that's going to confront the White House this week is, how do you function? How does a White House function, the most important workplace in America, function with the president testing positive? How does that isolation work? How do you mitigate the risk? And how do you continue working? That's a conversation going on in every office, large and small and medium-sized in this country, has been for months. The White House is now going to have to wade into that conversation and wade into it aggressively and transparently, explaining just how this is going to work and how you're going to deal with the medical issues of the president, but also deal with the functional day-to-day, hour-to-hour obligations of the presidency. And one of the things, as Nancy alluded to a moment ago, is probably going to come from this White House is, we can do this. Why? Because the president is vaccinated and boosted. Everyone who works with him is vaccinated and boosted. All right, so what does that mean to workplaces where that's also true? Can we think about our risks and mitigation and adaptation differently now? And is the White House going to be part of that new conversation that's maybe less fearful but cautious about COVID in terms of its management and application of getting work done, even though someone in a very important position tests positive? That's going to be the challenge for the White House, and how it meets that challenge will have a very great impact on the political ramifications and assessment of this moment.
Major, I mean, that's an interesting point, because it seems to me this could almost work out in, I don't want to say to their advantage, but it may not be necessarily a negative thing to say, look, everybody in America is dealing with this. We've dealt with this. We've covered each other's shifts when people are out for COVID. It's just a thing that is happening now at work, right?
How you do
exactly.
this.
Like, this is something we're all going to have to grapple with. The White House is no exception from that. The president is no exception from that. Here's the best way to do it. Now, the other end of that is they could not do that so well. Major, how do you think this is going to play out?
Look, I've learned, everyone who's tested positive for COVID has learned how disruptive it is to your life. It's disruptive to your work life. It's disruptive to your personal life. People either have to move out of the house or move to a different place if your house is big enough, but it's disruptive. That is the biggest truism and constant of COVID. It's disruptiveness, even if you don't get really sick. And if you get really sick, of course, the level of disruption is even higher. Again, the first order of business for the White House, the medical intervention, make sure the president doesn't get sick or sicker than he currently is. That's number one. But right after that is, how do you manage this? And the next thing is, because the politics always chases the White House, regardless of who the occupant is, how do you explain how that management process works? How do you deal with the disruption? Every workplace is trying to figure out that question right now, because losing vital employees for 5, 10, maybe longer days, depending how long you test positive, is a serious functional issue. Well, guess what? The biggest, most important workplace in America is now going to have to explain how that process works. I don't know how they're going to do it, but I know a lot of people are going to be watching and listening carefully to this management explanation about risk, mitigation, and adaptation. It's a big challenge. Whether they meet it or not, the public will decide.
It's the reality of the times that we are living in. Major Garrett, Major, thank you so much. And Major, will have much more on this and the January 6th hearing tonight on Red and Blue.
And Dr. Celine Gounder joins us now. She is editor-at-large for public health at Kaiser Health News and an infectious disease specialist and epidemiologist, lots of qualifications. Look, the president is vaccinated. He's double boosted. The White House says he's only experiencing mild symptoms. What sort of treatment should and will he be getting at this point?
So he's older. He's elderly, so he definitely should be started on Paxlovid, as he has been.
And for those of us who don't remember or may not be sure.
Paxlovid is a pill. It's an antiviral pill. It basically stops the replication of the virus, and it gives you time for your immune system to kick in and clear the virus. We have seen that Paxlovid keeps people out of the hospital, so it's really important that he was started on that in addition to his 4 doses of vaccine. We have not heard anything about him being short of breath, about him needing oxygen. Those would be some signs that he might need more aggressive treatment, things like steroids or monoclonal antibodies. We haven't seen anything that would point to needing more aggressive treatment.
I was going to ask, there's so much uncertainty, obviously, at this point, so much is unknown, right? But I think this is the question a lot of folks are wondering is, given what we know about COVID, given what we know about his advanced age, is there any way to tell what direction this particular case that the president has might go in?
It's really hard to predict. Now, he does not have any of the risk factors for severe COVID, so that's in his favor. He's not obese, he doesn't have diabetes, high blood pressure, heart disease. Those are some of the things that we worry about. He's gotten 4 doses of vaccine, so he's very well protected from that end of things, and he's now on Paxlovid. So I think the risk has really been mitigated very well. They will be checking his vital signs daily, I'm sure at least a couple times a day, to make sure his oxygen levels remain high.
Now, the president always has a busy schedule, but he had a very busy schedule yesterday and was seen multiple times without a mask. How concerned are you about him having spread COVID to others? And do you think maybe the White House masking policy should be changed?
It is certainly possible, if he was indoors with other people for an extended period of time, that he could have spread the virus to other people. I think it's important to remember, though, if you're outdoors, your risk of transmission is exceedingly low. Now, in terms of White House policies, I think they really, as you were saying earlier, they have an opportunity to role model. How do you deal with something like this? Because this is something every workplace is going to have to deal with. What do you do when somebody has COVID? I think it's become too much of a binary conversation, lockdowns versus a virus free-for-all. There's something in between. And I think a lot of us would love to be able to get back into a time machine, to go back to 2019. That's not the reality, okay? We are going to have to live with COVID, but we can also adapt and make use of these tools, decide when to scale up, scale down the use of these tools, like masking, for example.
Well, one of the things I never realized before this, in Asia, they've been wearing masks when they get sick for a very long time, and I never really got it. I always thought the person wearing the mask was worried about other people. But one of the things we've learned is that if you're not feeling well, you can put on a mask to protect people around you. And frankly, that made me feel a lot better. Now I do it, like if I have a runny nose and I'm going to the store, I'll throw one on just to make sure I don't get other people sick. Is that like a shift change that we could work on a little bit, and that the messaging could work on a little bit?
I think we could. I think we could try to get people to think, that's the polite thing to do. If I am sick, I don't want to get other people sick, I will wear a mask when I'm sick. I think we could also move to a system where, just like you take an umbrella when it's going to rain, you see on the weather report, to having on the weather report, today is a high, COVID risk day. Today you might want to bring a mask with you.
Or if you're going to take public transportation, or if you're going to be inside, just throw it in your bag.
That's right. That's right.
So, the thing I wonder about is that there may be some people who see this, though, and point to the fact that the president, especially early on, made it really kind of clear that they were taking every precaution necessary. They were holding these Zoom meetings in these kind of very, before the cameras in a very public way, and having the masks on. And then, as Nancy mentioned, we saw things relax. We saw, for instance, in Saudi Arabia, that image. And I wonder, Doctor, what you think when you see an image like that. The President of the United States sitting in a room without a mask with many other people without masks.
It's always a scramble to get in those rooms, right? Because every staffer wants their picture taken, every official, every wife, everybody's always trying to get in those images.
So what do you think, as a public health official, the message might be? You talk about role modeling, perhaps, but other people may look at it and go, well, if the President of the United States, who took precautions, went ahead and did these precautions and got COVID anyway, then why should I bother?
I think it depends on what kind of testing was happening there. For example, this morning before I went on CBS Mornings, I got a PCR test. It was negative. So you can be around people in that kind of setting without a mask indoors and feel safe if you have that kind of testing. I don't know if they were testing in that way. If everybody in the room was tested, if they all tested negative, I actually don't have an issue with it.
So you think, though, there is an opportunity here for people to look at what the White House is going to do from this moment forward. It's sort of a teachable moment, you're saying, for public health officials to kind of model for other organizations. There is the ability to live with this, because that's not necessarily a message that we've heard very clearly necessarily in the past.
Right. We don't have to go to back to Zoom meetings, or the White House doesn't necessarily have to go back to Zoom meetings. They could have people still in person meeting. In theory, even with the president, if he is masked and you have good ventilation in that room, they could even meet indoors together. But you need to have those other layers there and to know when to use them. And of course, you want to have everybody in the workplace vaccinated and boosted, because that also helps mitigate the risk.
All right, Dr. Celine Gounder, stay with us. Thank you so much. We also want to thank Major Garrett and Nancy Cortez. We're going to take a short break, and then we'll have more on our breaking news.